All right, everyone, we're going to go ahead and get started now. Like I said, my name is Zach Murray, and I am the Client Services Coordinator here at Earthbound Media Group. I want to go ahead and thank you for joining us today for our webinar titled Healthcare and Facebook, 100 Hospitals and Communities They Serve Communicate Through Facebook. Earthbound Media Group is an interactive marketing agency. We're based in Southern California. We specialize in expert consultation and implementation services for website redesign, content management projects, as well as online marketing and emerging media such as search engine marketing and social media strategy. Our presenter today, Elliot Darvik, is a member of our digital marketing team here at EMG, specializing in strategy and social marketing. Elliot has consulted on various projects for us for State Farm, Scottrade, Universal Films, 20th Century Fox, as well as many of our higher education and healthcare clients. As an agency, we have worked with healthcare clients such as Loma Linda University Medical Center, Banner Health, Cardin Children's Medical Center, St. Helena Hospital, and Fibron Dental. Before I turn it over to Elliot, I just want to remind everyone that you are more than welcome to submit questions throughout the presentation. Go ahead and input them into the question dialog box on your screen. Also, the slides and presentation will be posted on the Earthbound Media Group website as well as on SlideShare. I will be back later in the presentation with a few more specifics on how to find that information. Without any further delay, I'm going to hand it over to Elliot to get us going. Here you go, Elliot.
Hey, thank you so much for the introduction, Zach, and good morning, or I guess good afternoon, depending on where you're calling in from. So I want to get right into it and go over some of the learning objectives. And if you've been with us before for an EMG webinar, this is going to be a little different. A lot of times we'll kind of go over work we've done in the past and case studies and draw out best practices. And we're taking a bit of a different approach with this webinar where we've kind of undertaken some significant research, and we want to use this opportunity to share that research with you today. And so the first takeaway, learning objective, is we want to give you a comprehensive understanding of how we observe hospitals are using Facebook pages as a communication outlet, as an outlet where, where they're, to give you an idea of what kind of content they're coming up with and publishing and how they're using this as a way of connecting to the communities they serve. On that same note, we also wanted to understand and get a better idea of how communities are using Facebook pages to communicate with those same hospitals, right? Why does someone go to a Facebook page to post something to their wall? Is it a patient with a question? Is it a complaint, right? We want to really do an in-depth research study and try to come away with some concrete evidence of how communities are using Facebook to communicate back with hospitals. Something for this presentation, I really wanted this to serve, I want this to serve as an inspiration for you to translate these findings into immediate action for your organization and to produce new content. So you can see, and I've given plenty of examples, as you'll see in a couple slides, of how hospitals are using Facebook. I want this to be inspiration for your organization. Say, I love what they're doing, we should do something like that. And then finally, drawing out from the research that we did, just some observed best practices that we will share with you that are used by hospitals across the U.S. and in the hospitals that we thought were doing the best job using Facebook to communicate. And also kind of blending in our own experience in social marketing and our own experience with our clients on top of this research to really come up with a couple solid best practices. And so in terms of an agenda, I just want to give you an idea what you're in for this morning. The first part is just an overview of the research. Then we'll get into a deep dive of hospital to community, right? We're going to say how are hospitals using Facebook pages to communicate with their communities. Then a deep dive of communities back to hospital, right? What are people posting to Facebook pages belonging to hospitals? And then we figured, as long as we're spending all this time looking at how hospitals are using Facebook pages, we might as well take it a step further, and we're just going to give you kind of an overview of the different types of Facebook tabs we're seeing hospitals use, and then finally closing it out with observed best practices and some takeaways for you. And I also want to just mention, as Zach already did, please submit questions throughout. I love answering questions, and even if you don't think of a good one during the presentation, I'll have my email address at the end. Feel free to reach out to me. So with that, we'll get into an overview of the research. So when we approached this research, we set out to answer two questions. And the first one was, of U.S. hospitals that have Facebook pages, what type of content do they share? How are they using Facebook pages to share content, right? What is the content they're coming up with? And two, the second question was, what are the reasons and in the intentions of people that post the U.S. Hospital Facebook fan page, right? Why are they coming to Facebook fan pages? What are they posting? What are they looking to get? What information or questions, right? These are the two questions that the research we set out we want to answer. And here's kind of an overview of, I guess, our methodology. This is really how we put together the research, the study. So we started out with a list of 295 hospitals that had an active presence on Facebook and Twitter. And we thought that, and we actually started out with a much larger list. And I need to give a shout out at this point to Ed Bennett at ebennett.org. He runs a blog called Found in Cash, and if you've seen it before, he does an excellent job of just documenting all hospitals in the social space, and so it was a really helpful jumping off starting point. But we want to say, so from that giant list, we took 295 hospitals that had a presence on Facebook and Twitter. We figured this means that they have kind of a program in place. They're committed. And then we randomized this population and pulled out a sample size of 100 hospitals we were going to study. From this, we performed kind of initial research to come up with categories that you'll see in a minute, to categorize all the different types of content hospitals are coming up with, as well as the interactions we're seeing from the community to the hospitals. So then from this list of 100 hospitals, for each one of them, we went and recorded and categorized the last 30 hospitals to community posts. And then we also went for each one of these hospitals and recorded and categorized the last 30 community to hospital posts, right? Someone going to a hospital Facebook page and posting something. And that was that served as our data pool. And so from this giant data pool, we aggregated and analyzed it, and in the summer of 2010, it produced the research that we're sharing with you today. And just to give you an idea, we want to show you the audience distribution. So this is just kind of another insight. We took these 100 hospitals, and here's kind of a distribution of their audience sizes. So on one end of the spectrum, you'll have the Children's Hospital of Orange County that has a significant audience base, and on the other end, we might have a hospital that has only 61, audience of 61 people. So really had a very wide spectrum of audience sizes across these 100 hospitals. And I guess that, before we move into the actual research itself, I want to give you an overview of kind of logic we use to support this methodology and the approach. Why did we take this approach? Well, first we chose Facebook because we thought you're going to get a broad spectrum of the type of content hospitals are creating, because there's so many different types of mediums that can be posted to Facebook, whether it's just posting a blog post or video or photos. We figure anything a hospital is creating could be posted to Facebook, and it's going to give us a good general idea of the content they're creating. And on that note, we think a content-focused approach is very reflective of a core social strategy. We always tell our own clients, start with what you're going to be creating and go from there. And so we thought that would be able to give the most inspiration for you in growing your own social presence. And finally, we thought this population size accurately reflected a wide spectrum of hospital types and sizes and geographic regions. And so this is why we took the approach that we did. So let's get into the actual categories and start digging into the data. So in terms of hospitals and community, here's a high-level overview of how we saw the posts breaking down. At the top, we saw original content make up about 34% of posts from hospitals to community. And I'll get into what I mean by original content in a little bit. Then we saw external content at 22%, events at 20% of posts, announcements, PR, 13%, then conversation starters, employee recognition, rounding out the lower percentages. And overall, we looked at 2,855 posts across 100 hospitals during the time period. And then in terms of community to hospital, here's kind of an overview of how the posts broke out. At the very top, this I thought was really interesting, was just compliments and thanks at 36% of posts. After that was kind of self-promoting, and we'll get into what that means, with 23%, almost a quarter. Conversation starters at 17%. Then questions was kind of in the middle, suggestions, and then at the very bottom was photos and videos, people posting their own media. And interestingly enough, complaints only made up 2% of the roughly 1,500 posts we examined across 100 hospitals, which is encouraging. So if you're, health system or hospital that's wary about kind of opening yourself up to the beast that can be social media, you should be encouraged by this. That more often than not, you're going to find that people are just posting things you would want them to post. You know, I had positive experience rather than a criticism of how things are being run. So we found that pretty encouraging. And so now we'll get into the deep dive portion. This is really where we'll go over, we kind of gave you the categories, and then we'll break down into subcategories and even maybe subcategories of subcategories. So, and plenty of examples so you can understand kind of what we were looking at. So first, we talked about original content making up 36% of what hospitals are posting to their Facebook pages. We then broke down this 36% into 6 more subcategories. So 20% were photos, 20% was other, and we'll get into what that is. About 19% of that original content was videos. 16%, interesting, was health tips. 15% was news articles, and 10% were of the posts were just blog posts, just taking a, so a hospital had a blog, and they were using this as a place to repost. So here's kind of the subcategory of the subcategory. So in terms of photos, here are kind of the 4 areas we saw hospitals posting photos. Events, right? So Children's Mercy had a couple local comedians come in, and actors, and they posted photos from the event. Or employee spotlights was a big one we saw. So Nathan Lidenauer posting, a photo of an employee, spotlight on Candace Underwood, who's a physical therapy assistant. We saw a lot of hospitals posting pictures of construction, renovation. As anyone who works in a hospital system knows, there are always renovations going on, and this is a great place to share with the community kind of what those renovations are looking like, where appropriate. And finally, if you happen to live in Los Angeles, your children's hospital, and Hollywood is right next door, maybe you're posting photos from visits by celebrities or local athletes, right? And this is a great venue for this. Video was also really another popular source of original content. It could just be specific departmental info. So, Jefferson Myrna is, talking about their integrative medicine department, or also employee spotlight, so using video as a medium to spotlight an employee. You could use it as health and training tips. So Barnes-Jewish in St. Louis, talking about one of the trainers offering some training tips, or maybe event footage. So you had a walkathon, and you wanted to share footage. So video was really popular. Health tips was number 16%, was 16%. And I just have a couple examples of the health tips here. I should just add in, Jack said it, I know I'm going through some of these examples. If I'm going too quickly, this will be posted on SlideShare afterwards, so you'll have a chance to examine some of these. But, University of Georgia Health Center. Just a quick reminder, if you go on the game, bring sunscreen. So these are really just kind of easy pieces of content, original content that hospitals can create. News articles, so maybe there's an important milestone that's been hit, or maybe you have a newsletter you send out to a patient base. You can post that here. We saw about 15% of the posts from hospitals communities doing this. Blog posts. So Covina Mercy Medical Center has a pretty regular blog, and they use this as an outlet for posting those to the community. Pretty self-explanatory.